Extraction forceps are divided into maxillary forceps and mandibular forceps. We can differentiate between maxillary and mandibular, as mandibular has a right angle forceps and maxillary are mostly straight or obtuse forceps. Maxillary anterior forceps. Maxillary anterior forceps are completely straight 180-degree angle between the hinge and the beak, and the beaks are all completely approximating to each other. This is used to extract incisors and canines of maxillary arch. Maxillary premolar forceps. The beaks are little wider apart, and as and when we go posterior to the arch, the angulation starts increasing. So this is a little obtuse, not completely straight. This is used to extract premolars of maxillary arch. Maxillary upper molar forceps. They are paired forceps. There is a right and the left forceps, where we can identify the right and the left with the beaks. One beak is round, whereas the other beak has a pointed beak. This pointed tip goes in the furcation of the mesiobuccal and the distobuccal roots, whereas the blunt tip goes and engages the palatal root. So this is the maxillary right forceps. The similar left forceps will have a beak on the left side. This is a cow horn forceps. This is used to extract grossly decayed molars when the crown structure is completely gone. And the difference between the maxillary molar forceps and cow horn forceps is the shape of the beaks. The maxillary molar forceps are wider, whereas the cow horn forceps has the beaks shaped very slender beaks and resembles that of a cow horn. And these are also paired forceps. To identify between right and left, the pointed single tip goes in the furcation. So this is the maxillary right molar cow horn. This is a bayonet forceps, which is used to extract smaller root stems, slender root stems from inaccessible areas of the maxillary arch. Now this is an upper third molar forceps. Upper third molar forceps are also called as universal forceps or USA pattern forceps, as the difference is in the hinge, where the beak starts a little away from the hinge, and the beaks are little shorter and stout, so as to engage the crown of the upper third molar from an inaccessible area.